Did you know that prostate cancer is one of the most common cancers in men worldwide? And yet, its earliest signs are often so subtle, they go unnoticed? It's a frightening thought. A disease quietly growing inside without pain, without a warning, until it's too late. But here's the truth. Most men who catch it early can live long, healthy lives. The key is awareness. And today, that's what we're here to do. Welcome to Senior Fit, the channel dedicated to helping you stay healthy, strong, and independent at every age. If you're over 50, or if you love someone who is, this video could be one of the most important ones you ever watch. So take a moment, hit that subscribe button, and let's uncover the silent signals your body might be sending you. Let's begin with something simple: understanding the role of the prostate. This small, walnut-sized gland is located just below the bladder and in front of the rectum. It surrounds part of the urethra, the tube that carries urine and semen out of the body. Its main job is to produce seminal fluid, which nourishes and transports sperm. It may be small, but it plays a big role in a man's reproductive health. When the prostate is healthy, you hardly think about it. But when something goes wrong, like inflammation, enlargement, or the growth of cancer cells, it can affect everything from urination to sexual function, and ultimately your entire well-being. Prostate cancer begins when cells in the prostate start to mutate and grow uncontrollably. Some cancers grow slowly and may not cause significant problems, while others are aggressive and can spread rapidly to other parts of the body, such as the bones and lymph nodes. The problem? Many men don't experience noticeable symptoms in the early stages. That's why routine screenings and knowing what to look for are so crucial. In fact, catching it early often means simpler treatments, fewer complications, and a much better chance of a full recovery. Let's now talk about the most important factor in surviving prostate cancer: early diagnosis. In the beginning, prostate cancer might not show any symptoms at all. This is precisely what makes it dangerous. Men assume they're healthy because they feel fine and they skip screenings. But under the surface, something may already be happening. There are two basic tests that help detect prostate issues early. The first is the PSA blood test, short for prostate-specific antigen. PSA is a protein produced by the prostate, and elevated levels in the blood can be a sign of cancer, although other conditions like prostatitis or benign prostatic hyperplasia, BPH, can also raise PSA levels. The second is the digital rectal exam, or DRE. During this quick test, a doctor gently feels the prostate to check for abnormalities in size, shape, or texture. Unfortunately, many men avoid these tests because of fear, embarrassment, or misinformation. But here's the truth: these tests are quick, often painless, and can literally save your life. Prioritizing your health over discomfort is one of the smartest, strongest things you can do. If you're over 50 or over 45 with a family history of prostate cancer, these screenings should become part of your routine health checkups. Now, let's take a closer look at the risk factors. Some of them are beyond your control. Age, for example. Prostate cancer becomes significantly more common after age 50, and the risk continues to rise with every passing year. Family history is another major factor. If your father or brother had prostate cancer, your own risk is more than double. Race also plays a role. Black men are statistically more likely to develop prostate cancer and are often diagnosed at more advanced stages. Then, there are lifestyle factors. A diet high in red meat, animal fats, and processed foods can increase your risk. So can physical inactivity and being overweight. The good news? Good news? These are factors you can do something about. A healthier diet, regular movement, and weight control don't just improve prostate health. They boost your overall longevity and quality of life. So, what exactly are the symptoms you should never ignore? Let's break them down. The first, and perhaps most common symptom, is changes in urinary function. You might notice difficulty starting to urinate, a weak stream, or the feeling that your bladder doesn't empty completely. You might have to strain, stop, and start, or feel discomfort. These changes are often brushed off as part of aging or blamed on prostate enlargement, but they can also be early signs of cancer. If you notice any changes in how you urinate, don't wait. Talk to your doctor. The second symptom is nocturia, waking up multiple times at night to urinate. It might seem harmless at first, but if you're finding it harder to get through the night without several bathroom trips, your prostate could be pressing on your bladder. Interrupted sleep leads to fatigue, mood changes, and other health issues. More importantly, frequent urination at night could be a sign that something more serious is going on with your prostate. Third, the presence of blood in urine or semen is an urgent red flag. It might not always be visible, but if you notice a pink or reddish tint, or are told by a doctor during another exam, this could signal a tumor damaging blood vessels. Blood in these fluids can be caused by infection or kidney stones, but when linked to the prostate, it deserves immediate medical attention. Imaging tests and possibly a biopsy will be needed to understand the cause. The fourth symptom is persistent pelvic pain or discomfort. This could be a dull ache in the lower abdomen, groin, lower back, or even the area between your scrotum and anus. While muscle strains or age-related aches are common, pain that lingers or worsens, especially in the pelvic area, should never be ignored. Pain that radiates to your back or legs might indicate the cancer has spread. Next is a change in ejaculation. You may notice a decrease in semen volume, changes in its texture or color, or even pain during ejaculation. These signs may feel awkward to bring up, but they are important. The prostate plays a central role in semen production, and when something is wrong, those functions are often affected. Another important symptom is erectile dysfunction. While ED is common in older men and can have many causes, like diabetes, stress, or medication, it can also stem from prostate cancer. When the tumor affects nerves or blood vessels related to the penis, it can interfere with your ability to achieve or maintain an erection. Sudden or worsening ED should prompt a visit to a urologist. A seventh warning sign is the sensation of bladder pressure. You might feel like your bladder is full even after you've just emptied it. This may be accompanied by straining to urinate or a feeling of heaviness in the lower abdomen. An enlarged prostate can obstruct urine flow, leading to residual urine and increasing your risk for infection. Symptom number 8 is unexplained weight loss. This is one of the most serious signs. If you're shedding pounds without dieting or exercising, and your clothes feel looser than usual, it could be a sign that your body is fighting something bigger. Weight loss from cancer is often accompanied by fatigue, reduced appetite, or muscle wasting. Finally, chronic fatigue. We all get tired from time to time, but if you're feeling drained even after rest, or if your energy seems to disappear for no reason, it could be a sign of a systemic illness like cancer. Tumors can hijack your metabolism, disrupt your sleep, and weaken your body. If your fatigue is constant and unexplained, don't ignore it. Each of these symptoms on its own might be caused by something other than cancer. But when they occur together, or if any of them are persistent, you must seek medical attention. And even if you have no symptoms at all, routine screenings are still your best line of defense. So, what are the treatment options if prostate cancer is diagnosed? The answer depends on how advanced the cancer is and how aggressive it seems. In some cases, especially for slow-growing tumors, doctors may recommend active surveillance, monitoring the cancer closely without immediate treatment. This is often suitable for older men or those with other health issues. For more advanced or aggressive cancers, treatments may include surgery, radiation therapy, hormone therapy, or chemotherapy. Each comes with its own risks and side effects. Surgery to remove the prostate, called a radical prostatectomy, can be effective, but may lead to urinary incontinence or erectile dysfunction. Radiation therapy may cause bladder or rectal irritation. Hormone therapy helps slow cancer growth by reducing testosterone, but it can lead to bone thinning, hot flashes, and fatigue. Chemotherapy is typically used in advanced stages when other treatments haven't worked. While these treatments can be physically and emotionally challenging, many men go on to live fulfilling lives afterward. Support systems, physical therapy, counseling, and lifestyle changes all play a role in recovery and maintaining a high quality of life. Now, let's talk prevention. While there's no guaranteed way to prevent prostate cancer, there are proven strategies to lower your risk. First, eat a balanced diet rich in vegetables, fruits, whole grains, and lean proteins. Limit red meat, dairy, and processed foods. The Mediterranean diet, known for its heart and brain benefits, is also great for prostate health. Second, stay physically active. Regular exercise helps regulate hormones, boost immunity, and maintain a healthy weight, all of which are linked to lower cancer risk. Whether it's walking, swimming, or stretching, find something you enjoy and do it consistently. Third, reduce stress. Chronic stress weakens the immune system and increases inflammation, creating an environment where cancer can thrive. Meditation, hobbies, social connections, and even counseling can help keep stress levels in check. Lastly, break the silence. Too many men delay care because they're embarrassed or afraid. But talking about prostate health should be as normal as talking about blood pressure or cholesterol. Share this knowledge with friends, sons, husbands, and brothers. Join awareness campaigns. Support each other. And remember, your health is not a burden. It's your legacy, your strength, your freedom. By staying informed, vigilant, and proactive, you can protect yourself and those you love. When a man hears the words, "You have prostate cancer," it can feel like the world has stopped. It's not just the diagnosis that hits hard, it's the fear of what comes next. Questions swirl. Will I survive? What will treatment do to me? Will I still be able to live normally? And most importantly, how can I hold on to my strength, my identity, and my independence? The truth is, prostate cancer, especially when caught early, has one of the highest survival rates among all cancers. But surviving is just the beginning. What matters deeply is how you live after the diagnosis. And that's what this part is all about: reclaiming your life, maintaining your dignity, and moving forward with knowledge and power. Let's start with what happens after treatment begins. Whether you've had surgery, radiation, hormone therapy, or a combination, your body goes through changes. For many men, urinary incontinence, leaking urine, or needing to rush to the bathroom is one of the most challenging side effects, especially after a prostatectomy. It can feel frustrating, embarrassing, even isolating. But it's more common than you think, and it's often temporary. Pelvic floor, physical therapy can help tremendously. Simple, guided exercises to strengthen your pelvic muscles can restore bladder control and confidence. You are not alone in this journey, and with professional support, progress is not only possible, it's expected. Sexual health is another area that can be impacted, both physically and emotionally. Some men experience changes in libido or difficulty maintaining erections. This may be due to nerve damage during surgery, reduced hormone levels, or the emotional toll of illness. It's important to know that solutions exist. Medications, devices, therapy, and open communication with your partner can all help restore intimacy. And beyond physical solutions, understanding that closeness and connection can evolve in new and meaningful ways is empowering. Emotionally, the cancer journey can bring anxiety, fear of recurrence, or depression. That's why psychological support is just as important as physical healing. Don't hesitate to reach out to friends, family, support groups, or professionals. You don't have to carry this burden alone. Sharing your story, asking for help, and expressing your emotions are all signs of strength, not weakness. Now, let's talk about follow-up care. Once you've completed treatment, regular checkups remain essential. Monitoring PSA levels helps detect any signs of recurrence early. Imaging tests like MRIs or bone scans may be recommended depending on your case. Most importantly, ongoing conversations with your healthcare provider will help tailor your long-term care plan to fit your needs and goals. But it's not all about tests and appointments. This is also a time to renew your commitment to a healthy lifestyle, because what you do after treatment plays a huge role in long-term success. Let's revisit some of the most important lifestyle habits you can adopt to support your body's healing process. First, nutrition. After prostate cancer treatment, your body needs fuel, real, wholesome fuel. Load your plate with colorful vegetables, antioxidant-rich fruits, whole grains, legumes, and lean proteins like fish or poultry. Cruciferous vegetables such as broccoli, cauliflower, and Brussels sprouts contain genetic compounds that may help reduce cancer risk. Foods high in lycopene, like tomatoes, have also shown promise for prostate health. At the same time, limit foods that can trigger inflammation. Processed meats, sugary drinks, fried foods, and excess alcohol. These aren't just empty calories. They're known to fuel the very imbalances that cancer thrives on. Next, movement. Exercise isn't just about looking good. It's a powerful medicine. Even moderate physical activity, like brisk walking or light strength training, improves circulation, boosts immune response, supports hormone balance, and reduces fatigue. It can also help rebuild lost muscle mass and restore energy after treatment. Aim for 30 minutes a day, 5 days a week. But even less can still make a difference. Start where you are and build gradually. Sleep is also vital. Your body repairs itself most effectively during rest. If you're struggling with sleep, whether from anxiety, discomfort, or hormonal changes, talk to your doctor. Mindfulness techniques, breathing exercises, and a consistent bedtime routine can work wonders. And then there's the often overlooked factor, stress management. Chronic stress floods the body with cortisol, weakens the immune system, and promotes inflammation. Practicing stress-reducing techniques like meditation, Tai Chi, prayer, or simply spending time in nature can profoundly support recovery and overall health. Social connection is just as healing. Loneliness and isolation can be as damaging as smoking, especially for older adults. Make time for friends. Call your children or grandchildren. Join a local men's group or health class. Being part of something bigger than yourself nurtures emotional resilience. We should also mention the power of purpose. For many men, surviving cancer leads to a new chapter, one filled with renewed meaning. Whether it's mentoring others, volunteering, traveling, or simply savoring each moment, living with purpose gives each day more value. Life after cancer is not just about surviving, it's about thriving. Now, let's return to something important. Prevention. For men who haven't been diagnosed or who are in remission, prevention should be a daily focus. That means committing to annual screenings. PSA levels, even when stable, need to be watched. So does your overall prostate health. Don't wait for symptoms. Prostate cancer is most treatable before it causes discomfort. Regular digital rectal exams and conversations with your doctor remain critical, especially after age 50 or age 45. If you have a family history, remember, you are your own best advocate. No one knows your body like you do. If something doesn't feel right, if you're urinating more often, if your back aches for no reason, if you're losing weight without trying, don't brush it off. Don't wait for it to get worse. Your body whispers before it shouts. Listen to those whispers. Finally, let's talk about something bigger, the cultural taboos that stop men from speaking up. Too many men stay silent out of fear, pride, or shame. They avoid checkups. They ignore symptoms. They keep pain to themselves. But we have to break that silence. It's time to normalize prostate health. To make conversations about the body, aging, and cancer as normal as talking about sports or the weather. It's time for fathers to talk to sons, for husbands to talk to wives, for friends to encourage each other to get checked. Campaigns like Movember have helped shine a spotlight on men's health, but it's still up to us to continue the conversation. Share what you learn. Be the voice that saves someone else. Your courage to speak up might give another man the strength to seek help. To those who are currently battling prostate cancer, know this: you are not alone. Your body is capable of healing. Your mind is capable of strength, and your spirit is capable of rising, even in the face of fear. To those who have recovered, celebrate that victory. Use your story to empower others, and never stop taking care of yourself. And to those who are watching this today, wondering if this message applies to you, it does. Whether you're 50 or 80, whether you've been diagnosed or are simply cautious, this is your wake-up call. Your health is not a gamble. It's an investment. So take action. Schedule that screening. Eat better. Move more. Rest well. Talk openly. And most of all, believe in your body's ability to protect and heal itself, especially when you give it the care it deserves. Because early detection isn't just a medical phrase, it's a life-saving reality. Prostate cancer may be common, but that doesn't mean it's unstoppable. Knowledge is power. Awareness is protection. And early action is everything. So stay vigilant, stay informed, and stay strong. Thank you for watching this important message from Senior Fit. If you found this helpful, don't forget to like, comment below with your thoughts or experiences. And most importantly, share this video with someone you care about. You never know whose life you might be helping to save. And remember, your health is your power. Use it wisely.